There are a few basic things about the anatomy of the body that I think everybody should know. In addition to our internal organs, the function of the basic building blocks of the body that most people are never taught is the muscles, bones, joints, tendons, ligaments, and bursas. Injury to these 6 body structures is the source of most chronic pain. Understanding the function of the muscles, bones, tendons, ligaments, joints, and bursas is important for comprehending the phenomenon of pain and injury in the body. I'll briefly explain each one in relation to injuries and pain. Muscles hold the power of our body and are responsible for all our movements. They help our hearts to pump blood throughout our body, help us lift heavy objects, and give birth to our children. They have a simple job: to contract and relax. That's all they know how to do. Most muscles help us with voluntary movement, but some muscles are involuntary, like muscles of the heart and lungs. With their excellent blood circulation, muscles heal much faster than any other part of the body. While they may experience small injuries, they usually bounce back very quickly because of their good blood circulation. There are only a few exceptions. Bones give our body shape and structure, like the wood framing of a house. Bones protect our internal organs, like our brain, heart, and lungs, from severe impact. They have a thin membrane-like covering called the periosteum. Think of it as the skin of the bone. The centers of certain bones are like little factories that make and store our blood cells. They also store and release fat when the body needs energy. Along with the muscles and discs, the bones act as shock absorbers. Joints, such as the shoulder, form where any 2 bones meet. The joints are then enveloped in a gauze-like material, the white stuff you see here. The ends of these bones are coated with an articular cartilage, a smooth, Teflon-like substance for protection and gliding ability. A thin membrane inside the joint produces a small amount of fluid, a crucial component that allows the bones to glide against each other with minimal friction. When bones or joints are injured, they require a longer healing time, often taking months to recover fully. Tendons connect our muscles to our bones. They're like strong, flat ropes that are whitish in color. Let's look at the hamstring muscles and how they have tendons at both ends of the muscle. The hamstring tendons attach just below the knee to the lower leg, and another tendon at the other end of the muscle attaches to the bone at the bottom of the pelvis you sit on. When the hamstrings contract, you bend your knee. One of our largest, strongest tendons is the Achilles tendon. It attaches the calf muscles to the heel of the foot, so that when we walk or run, the calf muscles contract and lift your heel to propel us forward. Tendons are not attached to the bone itself, but to the membrane-like bone skin covering I mentioned earlier. When tendons are injured, they take many months to heal. Without proper treatment, tendon injuries can become chronic and last for many, many years. Now let's talk about ligaments. Ligaments are the strong, flat cords that hold our bones together. Whenever there are 2 bones that meet at a joint, there are multiple ligaments that hold that joint together, like the ankle, the lower back, and the wrist you see here. Without our ligaments, we would be a pile of bones on the floor. For example, the foot and ankle consist of 28 bones, 33 joints, and 112 ligaments. Here are the 7 primary ligaments of the ankle. The knee joint is a little less complex and has 4 major ligaments that hold the bones of the knee together. 2 are on the outer surface, called the collateral ligaments, and 2 right in the middle of the knee, called the cruciate ligaments, because they cross and form an X. All of the bones in your spine and pelvis are connected by multiple ligaments. When the ligaments in the spine get injured, it often leads to chronic pain in the neck and back. Ligaments throughout the entire body get injured frequently and have very little blood circulation and therefore heal very slowly. Most people don't know it, but chronic pain from sprained ankles, painful knees, as well as neck and lower back pain generally are caused by ligament injuries. Without proper treatment, ligament injuries can become chronic and last for many, many years. A bursa is a small, fluid-filled sac that acts as a cushion and gliding surface, reducing friction between various parts of the body. They're like small, flexible velvet pillows that nature inserted all over our bodies to reduce friction and injury. When we hear the word bursitis, it usually refers to a painful, swollen bursa in the shoulder. Bursas occupy a very small space. If this small bursa gets inflamed, it swells a lot and is very painful. There are 160 bursas in the body. They're mainly located between tendons, ligaments, and bones. The major ones are located next to tendons to reduce the friction, such as in the shoulders, elbows, hips, and knees. For example, the knee has 12 bursas. These are the 3 most commonly injured bursas in the knee. They get really big when inflamed. This commonly injured bursa hurts when you kneel down on your knee. To recap, muscles and tendons work together. Every muscle has a tendon, and tendons attach muscles to bones. Bones are held together by ligaments. Where any 2 bones meet is a joint. And bursas are the cushions between things to reduce friction. I hope you enjoyed learning about these parts of your body, and I hope they're clear now. Injury to these 6 body structures is what causes most of the chronic pain people suffer from. If you'd like to know more, see my website, benbenjamin.com. Thanks for listening.